Nicole Dunn is a physiotherapist and a consultant in aged care. Nicole has also appeared as an expert witness into the recent Royal Commission into aged care. Now, Nicole's testimony actually gave rise to some changes into the aged care, and Nicole is also a regular, thankfully, here at the Informer. Now, Nicole today is here with us again to talk about some of the problems that can arise through our older folks ending up in hospital. Welcome, Nicole.
Thanks for having me, Michael.
You're welcome. Now, our oldies, our beloved oldies ending up in hospital, it's something that unfortunately happens way too often. What are some of the main reasons that lead to this?
Yeah, so certainly it could be an acute event, something like a heart attack or a stroke, but it doesn't always need to be. You know, we often see chronic health issues, whether that be chronic heart or chronic lung issues, can certainly lead to someone being in hospital, and sometimes they're preventable. What we do know is that when an older person ends up in hospital, sometimes it's not always just 1 or 2 days. It can end up being weeks or even months if quite significant medical treatment is required. And if someone has been very unwell, again, what we see is that there can be a need for someone to remain in hospital on a rehabilitation ward. So they undergo, that extensive and intensive rehabilitation that can only occur in a hospital setting. So it can end up having quite a significant impact for older people.
I note there are some extra problems that can arise from the actual hospital visit that weren't there prior. What are some of those things that can eventuate?
Yeah, so look, there are complications that can occur, and whilst hospitals are an important place to receive medical treatment, often the complications can occur from spending too much time in bed and more than what is normal. So they can be things like blood clots or pressure areas. It might be hospital acquired infections from cannulas or catheters. And what we even see with older people who might have conditions like dementia is that when they're put in an unfamiliar environment like a hospital, it can cause sometimes memory to regress and cognition to be a bit more challenged, and particularly if there are lots of moves within a hospital. Certainly things such as weakness and frailty and falls can also occur from spending just more time in bed than what someone would be used to.
Great. How do we minimise the admission to hospital? Do we need a better primary care to stop them going? Do our older generation leave it a little bit too long and end up in the hospital rather than seeking help, in your opinion?
Yeah, look, I think there's certainly a very strong role for primary health and in particular preventative health measures. There can be lots that can be done, particularly around chronic health conditions such as diabetes, COPD and heart failure conditions, whether that be diet management, medication management. The role of exercise has a really important role in managing health conditions. So there's lots that can be done to prevent hospitalisation. We do see a bit of a reluctance sometimes for people to go see a doctor or to attend hospital, and sometimes these things can be left to the last minute, and that often just makes the situation worse.
The self-autonomy is a very, very big issue for our older people, and that fear of losing it should they go in. Is that one of the factors that you see in them delaying treatment?
Yeah, look, it certainly is a factor that I have seen older people, delay treatment because they worry, will I get back home? Will I end up in a nursing home? What will happen if I go and seek treatment? But again, what we often find is that the inverse happens, that the more you delay things, the more unwell you can get, the more likely you are to spend longer in hospital. So, the key message would be to be proactive about your healthcare and seek that, consultation by a doctor earlier. Don't leave it.
As a younger generation with older parents or older loved ones of any description, what is the best way we can encourage them to be proactive? How can we help facilitate that without driving them away from us?
Yeah, so I think, education and knowledge is really key. That's something that I do with my clients day in and day out. So my role is to educate people about the home care system, about my aged care. So how can people be supported at home? And really removing some of those myths that aged care is only residential care or nursing care. There is a lot that can be put in place at home. So when people, realize some of this and they have this knowledge, then that's when they often do or are more inclined to go ahead and make different decisions, whether that be, having a nurse involved in their care, or a physiotherapist, or an occupational therapist, or, having their memory checked or their medications checked, or arranging some home care services. So, really that knowledge is key.
I'm a huge fan of connection and community for healthy ageing, and we know the studies show overwhelmingly longevity is impacted as much by our social sphere as our physical activity. How do we enable that with our older generation?
Yeah, I think you've really hit the nail on the head in terms of saying that, community and connection is key. I've seen lots of older people where that's been lost in the lockdowns due to COVID, where people haven't been able to go out to get their shopping or go to a hairdresser or see their friends. And that is what really keeps people independent, is pushing on to do all the normal day-to-day things that they can do themselves without that being, taken over too much, by family, often well-meaning. That's what really keeps people going, is that community connection and key, and activity with the day-to-day things that they would normally do.
Great. Yep. I love our older generation, but the fact that they don't want to be seen as a burden and don't want to reach out, I think does a great disservice to not only us younger ones that would love to be part of it, but it's counterproductive, isn't it?
Yeah, it absolutely is. So, I guess we have seen a little bit of a change in carers over the years. Traditionally, children, and in particular daughters, would have been staying at home looking after someone. And now, most children are having to work. And, it is a little bit difficult balancing work, family responsibilities with caring responsibilities of older parents. But you're right, many older people, they don't want to worry their sons or their daughters. That's the key thing that I hear all the time. So they might not tell them if they've had a fall, or, if they've had a health event. They might not mention they've recently been to the doctor. And again, what tends to happen is that things tend to snowball, get more difficult if you're not reaching out for help. And there is often a crisis point, and that does tend to worry not only the older person, but in particular their family, even more, because suddenly something's happened that they weren't aware of.
Okay, Nicole, to wind up today, top three tips. Let's go one for the younger generation, supporting our older loved ones, neighbours, friends, anything like that. And the top two tips for our older generation as to possibly avoiding a hospital stay and remaining vital and active into the years to come.
Yeah, absolutely. So my top tips would be to be informed. And that might be, and this goes for older people and the younger generation, whether that be having a look at the My Aged Care website, or if that's looking a little challenging, reaching out to a expert, a professional that can help you with that. And for the older generation, it's making sure that you have a good relationship with your GP, your family doctor, and that you regularly see your family doctor, not just when things have gone wrong, but also for those regular health checkups to make sure everything's going right. And certainly investing in preventative health measures, whether that be you are engaged with a physiotherapist to keep you strong and well, or a dietitian or other health professionals whose role is to keep you well and at home.
Great. Well, there you have it, folks. Nicole Dunn, physiotherapist to the stars and a great advocate for healthy ageing, regular on the Informer. Thanks so much, Nicole, and we look forward to seeing you soon.
Thank you.